Hey, welcome to Men's Health Matters. I'm Glen Macnow. I'm here at WIP, and I'm here with Dr. Michael Sabia, Director of the Cooper Pain Management Center. Doc, nice to see you today.
Thank you.
Dr. Sabia is going to answer the questions that you have submitted about joint pain, so here we go. And a lot of good ones this month, by the way. Here's the first one. Hey, Doc, I have a shooting pain in my shoulder that goes away when I take prednisone. However, it keeps coming back. Can I just keep taking the prednisone, or should I seek a different treatment?
So prednisone is in the category of a steroid medication, and intrinsically our body makes steroids every day. When we're receiving them from the outside, it slows down or even stops the internal production of steroids inside our body. So that can change our dynamic throughout the day. It can affect our blood sugar throughout the time. So taking steroids long term also have effects on other parts of our body, including our eyes and our joints. They can cause glaucoma down the road, other joint weakening problems with bone degradation, osteoporosis, again, raising your blood sugar if you have diabetes already. So steroids of prednisone and others are great anti-inflammatory medications, but they're probably not the best long-term way to manage pain.
So you would suggest that person consult with a physician
Correct.
over the long term. All right, let's go to the next one, which is about rotator cuff pain. And very simple question, can physical therapy manage rotator cuff pain?
Absolutely. I'd probably break that down into two simple categories of inflammation versus a structural defect. If there's tendinitis or tendinopathy there, some type of inflammation in and around the rotator cuff or shoulder joint, physical therapy is pretty efficacious at helping that type of pain. If there's a structural defect, a partial tear, a full thickness tear, something that's torn inside the rotator cuff, physical therapy may help those patients as well, but it's probably better to seek consultation with an orthopedic surgeon at that point to determine if that tear needs to be corrected surgically.
All right, now we've got several questions about over-the-counter medication. Here's the first one. Can I take 2 Aleve in the morning and then 2 at bedtime over a long period of time?
So Aleve, Advil, naproxen, ibuprofen, they're all anti-inflammatory medications, but slightly different compared to the prednisone class. The Aleve, Advil, naproxen are in the non-steroidal. They don't act as steroids. And they work on a very specific pathway in our body called the cyclooxygenase pathway. And the end result of that pathway is to produce inflammation.
Yeah, I've always wondered, how does it know where I hurt?
These drugs work on a very specific receptor, and those receptors are all throughout the body. And again, ultimately you're producing inflammation. But besides the production of inflammation, that pathway produces other things called prostaglandins. So if you're blocking those prostaglandins long term, they have other function in the gastrointestinal system, in the bloodstream, in our cardiovascular system. They help reproduce some of the lining in the GI tract. So long-term use of Aleve or Advil can lead to stomach ulcers, gastritis, stomach bleeding. In the blood system, it can lead to blood in the urine or easily bruising or bleeding. And in the cardiovascular system, those prostaglandins help regulate certain tone of the blood vessel. It expands and shrinks the blood vessel. So if you're blocking those prostaglandins repeatedly, patients are at risk for some events of myocardial infarction or a heart attack.
All right, so use as sparingly as you can, I guess, is your answer.
Correct.
All right, so the second one, kind of the flip side of that, which is the person says, I've had multiple surgeries this summer. Aleve isn't working anymore. Is there anything else that can give me relief from joint pain?
So thankfully there's a host of different medications that work differently besides the Aleve, Advil, or the anti-inflammatory class. There's medications that help relax the muscles, muscle relaxants, other medications that work directly on the nerve, that slow down the transmission of the nerve fibers, other medications that work centrally right on our brain to help stabilize some of the chemicals that are involved in the transmission of pain. So if Aleve or Advil isn't working for you, thankfully there's a lot of different medications out there that your primary care doctor or a pain specialist like myself can help determine which one will be best for you.
All right, one more question kind of along those lines. I run about 5 days a week, 3-4 miles a day. First of all, you're already ahead of the game with everybody. Good for you. My knees end up killing me by the end of the run. Well, there you go. But I love it. Do you think it's bad to be consistently taking Advil this time for the pain, or is there something else I can do to prevent the pain? I run mostly outside on pavement.
So I think getting that exercise in, as you said, Glenn, is very important. So stopping the exercise is not the answer to that, but maybe modifying it to the point where instead of 3 or 4 miles a day, do 1 or 2 miles a day. Stretching before and after you exercise, making sure you're well hydrated. But relying on the Aleve or Advil or any of those anti-inflammatory medications long term isn't what's best for us, because again, those medications block other things besides inflammatory chemicals that can cause harmful effects down the road. So I would adjust the workout by running a little less, stretching, staying hydrated, maybe have a consultation with the shoe specialist to make sure you have the right shoe, sneaker on.
Mm-hmm. Dr. Sabia, would you recommend, he says he runs on pavement, or she actually, we don't know. Would you recommend as an alternative running on a treadmill, or you get a little cushion?
Yeah, that can add some benefit and take a little less stress and strain off the joints.
All right, here's the next one. Do you think that the knee wraps that athletes wear help with pain or prevention of pain? I run a few times a week. My knees constantly hurt. A lot of that going around. My knees constantly hurt when I'm running. Do you think wrapping them in these sleeves would help?
They can add some benefit, some of those sleeves or braces that the athletes are wearing, and generally there's usually a structural defect that's pre-existing. So the knee in itself has the meniscus, the ligaments, the tendons there. If there's a partial tear in the meniscus or ligament, the sleeve should actually fulfill that job duty of what that ligament is normally doing. So patients who have an intact knee and there's no tear, the sleeve may not add much benefit, but if there's something inside intrinsically that's not properly connected to the knee, like one of those tendons, then that brace or sleeve can pick up the slack and give the knee as much function and flexibility as possible.
Okay. Well, this guy, I guess, probably has run a little bit more. And this is one right after my own, this occurred with me. My doctor said I'm going to need a knee replacement. I had 2 of those, Doc. But I'm not ready to take that step. Is there any way to deal with that pain without surgery?
Thankfully there is. There's, again, a host of different oral medications that we can prescribe that can help with pain, whether it's controlling the inflammation, slowing down the nerve signals that transmit pain either from the brain or in the peripheral nervous system. And there are some nerve blocks we can do as pain specialists that can buy you some time or help with the pain. One specifically is called a genicular nerve block that not too many primary care or referring physicians are familiar with. That's a specific sensory nerve that's involved in the knee. When it becomes inflamed or abnormally transmits pain, it can make you be very aware of the constant knee pain that patients experience. And we can do a nerve block into that nerve, and if that helps you, we can actually ablate that nerve or burn the nerve, since it's not a motor nerve. It doesn't allow you to move your leg at all.
Do you ever recommend a cortisone shot as something along those lines?
Yeah, occasionally we do. So cortisone injections into the knee joint or around some of the surrounding nerves are very effective in clearing out some of the local inflammation that can occur there.
All right. Here's one. I'm a bariatric weight loss candidate, and I was told to start an exercise program, but I need to have knee replacement surgery. I've tried to work out, but the pain is pretty severe. Is there anything to dull the pain so I can continue to work out? I need to reach my goal weight for the weight loss surgery.
Sure. So with those patients, we would recommend the consultation with someone like myself, a pain specialist, because a lot of times there's comorbidities, there's other medical issues that go along with patients who are a candidate for bariatric surgery. They may have sleep apnea, they may have other lung issues, so I can't just shoot from the hip and say this medication is best for you. We would determine based on their other medical problems how their heart and lungs are functioning, what would be safest for them to take either by mouth or even some topical creams that we can prescribe over the knee, and come up with a safe exercise plan that they can do at home to keep them mobile, keep blood flow to that extremity as well.
Right, and don't give up the workouts there. Thank you for your questions, Dr. Sabia. Thank you so much for your time. To learn more about the pain management program at Cooper University Healthcare, please visit cooperhealth.org. I'm Glen Macnow of WIP, thanking you for joining us.